healthresourcedirectory.org.au. Patient Fact Sheet. Contact tracing. What is it? You've just found out that you have a sexually transmitted infection, STI. There's a lot going through your mind, and getting treated as soon as possible is vital. Besides getting healthy, you need to make sure everyone you've had sex with recently knows to get tested too. Doctors call this process contact tracing. Contact tracing is important for several reasons. To make sure your previous partners get tested and treated, to stop your previous partners accidentally spreading the infection to other people, to make sure you don't get reinfected if you're still with the same partner. Contact tracing is extremely important if you have HIV, which is a life-threatening condition. Starting early treatment gives you the best chance of living well with HIV. It also helps to limit any further spread. What will my GP do? Your GP will work with you to find the best way to complete your contact tracing. You can choose the option that makes you feel most comfortable. You can also talk to your GP about how your partners may react and plan some strategies for dealing with these. How to notify my partners. If you choose to notify yourself, your GP will guide you on what you need to say to make sure you're giving your partners the right information. Help you work out how to tell your partners, either online or in person. Give you a letter for your partners to help them determine their next steps. Refer you to a specialist sexual health clinic for dedicated support to help you manage this. If you ask your GP to notify your partners, you'll decide who will do the telling, your GP, health provider delegate, or another health agency. You will need to give consent. Your GP will never contact anyone without your consent. You can remain anonymous depending on how comfortable you feel about the process. Your GP will also help you find ways to reduce the chance of this happening again. These strategies can include condom use and regular STI testing. In some cases, your GP may refer you to a specialist sexual health clinic, for example, if you have HIV, syphilis, or gonorrhea, or if you are having trouble getting in touch with your previous partners, or if you are getting repeat infections. Ways to notify your partners. Notify your partners yourself. Ask your GP to notify your partners, either anonymously or on your behalf. Use a contact tracing service to send an SMS, email, or help you write a letter. Get assistance from the Liverpool Sexual Health Clinic. How far back to trace? You don't need to tell every partner you've ever had about your STI. Here is a guide to help you work out how far back you need to trace. Current partners only, trichomoniasis, Mycoplasma genitalium. Partners within 2 months, gonorrhea. Partners within 3 months, primary syphilis. Partners within 6 months, chlamydia, hepatitis B, hepatitis C, secondary syphilis. Partners within 12 months, early latent syphilis. What can I do? Many people with an STI don't know they have it because they have no symptoms. Despite this, they could still develop complications or pass the disease on to a new partner. Here's how you can ensure the contact tracing process flows smoothly. Make a list of all your potential partners who may need to know. Think about cues, such as certain locations or events. Even if you've only had one sexual partner, you still need to let them know. Request a referral to a sexual health clinic if you prefer to speak to a sexual health professional. What supports are available? The Liverpool Sexual Health Clinic offers private STI testing and diagnosis. The clinic can also help you with contact tracing, and staff can help you manage and cope with your STI diagnosis. You can either ask your GP to refer you or contact the clinic directly. The address of the clinic is ground floor, 13 Elizabeth Street, Liverpool. Phone 9827 8022. Contact tracing websites. The following websites can send an anonymous SMS or email to let your partners know they need to get tested. Let Them Know. Look them up at letthemknow.org.au. The Drama Down Under. For men who have sex with men. Look them up at thedramadownunder.info. Better to Know. Aboriginal and Torres Strait Islander specific. Look them up at bettertoknow.org.au/notify. What question should I ask my doctor? There's a lot going through your mind, and it can be easy to forget the questions you want to ask your GP. Here's a list of questions you may wish to ask. Why do I need to tell people? Who should I tell? What do I need to tell them? Do I need to make sure they get tested? What if I'm too embarrassed to tell others? Will my family and friends find out? Where can I get more help and support? What if I have no way of contacting my previous partners? This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by South Western Sydney PHN's Community Advisory Committee and local GPs.